Hello, and welcome to this edition of COVID Ethics Update, a service of the Center for Practical Bioethics during this pandemic situation. Thanks for joining us. My name is Terry Rosell. I work as the Rosemary Flanagan Chair at the Center. Our topic today is coronavirus pandemic and African American communities. My guest is Broderick Crawford, who is Executive Director of New Bethel Church Community Development Corporation. Thank you, Broderick, for being with us.
Thank you, Terry, for having me. It is my pleasure.
And I have a few questions for you. One is, I happen to know that you've been coordinating a weekly coronavirus meeting that involves community health leaders and faith leaders. I have been able to join on most of those meetings. Why are you coordinating that? Why have you been interested in doing that?
So a couple of things. Being a former KU health system employee and a person who has worked in the healthcare field for over 35 years, it was very alarming to me when we initially learned that the initial tests that were being provided at the KU Indian Creek campus and St. Luke's Internal Medicine in the Plaza. And at that time that the initial tests were being provided, the only death at that point was in Wyandotte County. So it was very alarming for me to see that tests were being done in areas where at that time there weren't any deaths. And the one area where there was a death, no testing was being provided. So I called upon the medical officials there at the health department and at KU to see how we could address what I saw as being inequities and discriminatory practices that were happening as it relates to where testing was being provided. I also wanted to make sure that my voice was not the only voice, although I am a resident of Wyandotte County and have been here for a number of years, so I might have just a little bit of influence, but also to have those individual pastors and health leaders a part of that conversation. So it was not a singular voice, but one that truly resonated within the community as a whole, with the residents and those folks that were being impacted in an adverse way.
So there was, it seemed there was disparate availability of coronavirus testing. And then I recall also that the turnaround time, and this was back a few weeks ago. I think it's improved significantly since then, at least in a lot of areas. But the turnaround time could be up to 10 days for the testing that was available in your county.
Absolutely correct. It was, for me, very alarming that an individual who may have been in a hospital may have gotten those results, let's say 12 to 24 hours. But if you're in community, you had to wait, it could be as many as 10 days. And for the community to have testing results to that level, to that length of time, I thought was very much unfair, and that needed to be addressed.
Has it improved since then?
Absolutely. So working again with Dr. Alan Greiner and with the KU Med Center and other labs that are now providing testing, we now within the community can get results within 12 to 48 hours. And I can say that firsthand because my own youngest son had symptoms and was tested at the Wyandotte County Health Department, and he got his results within 72 hours. He was tested on Thursday, and we had his results by Sunday.
So
he was negative.
Good, good. Glad to hear that. So you mentioned Dr. Alan Greiner. Dr. Aaron Carbo also has been in these Zoom meetings with community leaders, and they work as medical directors for Wyandotte Unified Government here in Kansas City, Kansas. So they and other health community leaders from some of the area medical centers seem to be listening.
Absolutely. I am very pleased with the response that we have received, not only from Dr. Greiner and Dr. Corvo, but also health department leadership, and then also KU leadership. We've been very fortunate to be able to talk to folks on the med center side and also on the health system side. And in both cases, I would say that they are definitely listening. They are receptive to what is being presented to them and genuinely want to make sure that everyone, every county, every resident, every area is tested in a very equitable way, in a way that aligns with the protocols that have been established and not just based on geographical area.
Thank you for your leadership in that, Broderick. I appreciate when folk notice something that seems to be wrong and then actually get together with other people to try to resolve that issue. So thank you for your leadership.
Absolutely. As I often say to my friends at KU, I bleed crimson and blue. Being a KU grad and also a former KU employee, I want to make sure that my alma mater is properly represented, but then also be able to provide input and feedback to them when things may not be fitting. And I don't think that it was anyone's malicious intent. Sometimes we just don't always think about some of the things that fall in the gap, and being able to share what those gaps are, what those barriers are, in a way in which it provides the best possible health outcomes for all.
And one of the principles that we share in bioethics when working with healthcare leaders on preparations for disaster situations or a pandemic situation like this one of the key principles is community input. And so that this illustrates the need for that and how community input can actually make a difference. We've also been talking in those meetings weekly about communications with the African American community, Latinx communities, about healthcare information, specifically now in the pandemic. How is that going?
So we are still making strides. It is not to the level of saturation that I think is necessary. But one of the things that we often lose sight of is, particularly in minority communities, certainly the African American community, the Latinx community, and even some of our immigrant communities, they don't have access to electronic media like those of us who have it. And so in many cases, so for example, my mom, who again was tested positive, my mom doesn't have the ability to do a Zoom call. My mom does not have access to a laptop or to a computer. But she still needs to be able to receive and be aware of all the information that's available. So we have to look at different ways of communicating to individuals that may not be in the mainstream electronic media. And so we've talked about how we can get information, whether that be flyers, whether that be via verbal communication, to places like food pantries, to places like churches, to places like where individuals are potentially at a bus stop. You know, how can we be able to meet people where they are in a safe, using, again, physical distancing guidelines? How can we continue to provide information to people in a way that allows them to be up to date, up to speed with current information. At my church, in New Bethel Church, we continue to have our pantry open on first and third Wednesdays of each month. And I happen to participate on the most recent pantry, and we had 175 cars, 175 cars, which equates to about 400 to 500 people, if you will, when you count the children and seniors and things like that. They came to the pantry. Our numbers have doubled, and in some cases almost tripled to what our normal provision would be. And so we were able to then, of course, we handed out sacks, everybody was masked and gloved, but we put flyers, we put information in those sacks of groceries that we were handing out about what's available here in Wyandotte County. And so that was a way in which, and since then, we've already received phone calls not only at the church, but also at the health department because of the information that we have now provided. The information is provided right now in English and in Spanish. We're looking to do some Burmese and also some Nepali translations so that we can meet the needs of the community. You know, Wyandotte County is very unique in that we have arguably 25% in three major ethnic groups: African American, Caucasian, and Latino. And then our immigrant community is also rising as well. And so we're very unique in that we have the opportunity, because we're so diverse, to meet the needs of multiple communities in a way that, again, provides the most positive health outcomes for all.
Thank you. I have one other question for you, Broderick. I'd like to hear your thoughts on some very sobering statistics that are coming from the CDC and from particular states and municipalities regarding coronavirus infection rates, illness rates, and mortality rates. One of those involves African American populations, which account nationally for about 13 to 14% of the U.S. population. But some of the statistics that we're reading now from the CDC indicate that about 30% of the coronavirus infections are within the African American community, and maybe about a third of the deaths. In the state of Wisconsin, it's even greater than that, with about 6% of the population. African Americans account for 40% of the COVID-19 deaths. What are your thoughts about that kind of disparate statistic?
It is absolutely alarming. While we're talking, I've actually pulled up the map from Wyandotte County, the county in which KU, one of the counties in which KU serves, and the county in which I live. Right now, according to the current data, 52% of the positive tests in Wyandotte County are African Americans. 65% of the deaths are African Americans. Yet African Americans only make up 23% of the population. To me, that's absolutely alarming that you have a particular ethnic group that is being adversely impacted in such a way. We also know that the Latino community is right now choosing not to be tested in many cases, whether that's fear of being deported, whether that's fear of linkage to care, whether that's just fear and distrust of the actual medical community. There are a number of reasons. So I would submit that once we are, as you're aware, we're about to launch actually our first pop-up testing site this afternoon from 3 to 6 in a primarily Latino church. And I'm afraid that once we actually get the trust and get the Latinx group actually being tested, that their numbers are going to blow out the water. Because when I go around, you know, I'm one that is very difficult for me to stay inside. And so from time to time, I'll just drive around in my car and just kind of get some air, if you will. And I still see people in Wyandotte County still congregating together. You can go to several different, unfortunately, liquor stores where folks are still congregating. You can go to certain parks where folks are still congregating and without masks. And so for me, I believe that we have not seen the peak, although we're predicting within the next 2 or 3 weeks. I don't think that's going to happen. I think once we get these pop-up testing sites off the ground and running, we're going to see alarming rates within the minority communities because they still have not grasped the severity of the virus and how it can negatively impact not only individuals, but also their families. My pastor happens to live in Olathe, and he made the comment recently on at our executive staff meeting that when you're in Johnson County, everybody's masked up. But when you come to Wyandotte County, you don't see the same. And so one of the key things that I think is very important for us is to help individuals in Wyandotte County better understand the risk that is involved when they're not abiding by the physical distancing, they're not abiding by wearing the mask, and they're not abiding by the stay at home, particularly in the African American and Latinx and immigrant communities who don't trust the system. They don't trust, when I say system, is not just the health system. They don't trust government. They don't trust police. They simply don't trust the system. And so that's why it is very important for leaders in our community to sound the alarm from a trusted voice, for champions to go out and say, hey guys, we need to be abiding by this, and not just say it, but demonstrate it, to model the behavior that needs to be, take place.
Broderick, thank you so much. We could go on, but we have a relatively brief podcast protocol, so I'm going to stop it there. But thank you so much again for being on COVID Ethics Update with me. Thanks for your leadership in the community and for sharing your views with us. I just note that views and perspectives of our guests don't necessarily reflect the positions of the Center for Practical Bioethics. Thank you to those of you who are joining us for this edition. And if you have any questions, ideas, comments, or suggestions for COVID ethics updates, please email us at covid@practicalbioethics.org. That's covid@practicalbioethics.org. And if you've not yet registered for the COVID ethics update, you can go onto our website, www.practicalbioethics.org, and you are able to register there. Thanks again for joining us. Be safe and stay well.